In my practice, we see a lot of women who have unbelievably high quality health. They're doing great. They're maybe 40 years old or 60 years old or 80 years old, and they're doing well. They're healthy and strong and do well, except that they get urinary tract infections recurrently. In women who are sexually active and healthy, that's pretty common. If a woman gets a recurrent UTI, RUTI in the medical literature, then typically they're recommended to get antibiotics. But the archives of internal medicine breakthrough moment, they have actually said that cranberry juice or cranberry products that are natural, not the supplement, but the natural products, actually can act like a drug to prevent recurrent urinary tract infection. The reason I'm excited about this is that there's a huge momentum in the direction of natural treatments being used in lieu of antibiotic therapy or drugs, which makes a lot of sense to me because cranberry is a healthy food on a bunch of levels. It's an antioxidant, it's got a lot of good healthy nutrients on a bunch of other levels, but it has a specific chemical called D-mannose, which is a simple sugar in tiny amounts, and it makes the bladder wall so slippery that bacteria can't hang on. So people with recurrent urinary tract infection are generally off the hook and they don't have to take antibiotics. Not that they'll never get an infection again, but the rate is dramatically decreased. But the bigger thing is the Archives of Internal Medicine, which is a very conventional piece of literature, is now moving in the direction where they recognize that not only do people want nutritional supplementation, but they need nutritional supplementation with natural foods. I believe that the active ingredient called D-mannose that's in cranberry is equally effective to cranberry juice. They haven't produced literature in the conventional setting, but there's lots of non-conventional literature that shows that D-mannose does work as well. So you get with your doctor if you have an issue like that and figure out what's your best plan. But I would suggest if the Archives of Internal Medicine says cranberry juice works, you ought to think about it. Get with your doctor. We're better together.